A 2-year-old boy is admitted with a displaced fracture of the left mandibular body and a non-displaced fracture of the right mandibular ramus. The diagnosis is made with CT scan imaging. So this is a 2-year-old boy with displaced mandibular fractures, and the treatment plan should take into consideration long-distance travel. How would you face the case? Option A, maxillomandibular fixation using piriform aperture drop wires and circummandibular wires. Option B, thermoplastic splint fabrication and circummandibular wires without maxillomandibular fixation.
The votes are in, and you chose B.
Hi, my name is Danny Balkin, and I'm a reconstructive plastic surgeon at Boston Children's Hospital and an instructor at Harvard Medical School. I specialize in caring for children with complex craniofacial, hand, and microsurgical challenges. In this manuscript, the authors describe a 2-year-old child who presented with a mandibular fracture. His injury pattern consisted of a non-displaced right ramus fracture and a displaced left anterior body fracture. In children, fractures tend to be non-displaced or minimally displaced, and in the majority of cases, the fractures can be treated conservatively. Young bone has very unique physical properties. Bone fragments unite partially as soon as 4 days after trauma and are relatively difficult to reduce by 7 days. Non-unions or fibrous unions rarely occur, and very slight occlusal discrepancies resulting from the lack of perfect reduction correct spontaneously as the permanent teeth erupt and the bone undergoes remodeling with function. If displaced, closed reduction and immobilization is preferred over open reduction and internal fixation, which carries an increased risk for damage to developing tooth buds. Methods of dental alveolar stabilization must be modified based on the patient's age and their dental maturity. In this report, the patient was taken to the operating room where he underwent a closed reduction of the fractured elements. Temporary stabilization was achieved with a circumdental wire. While in the OR, with the assistance of a pediatric orthodontist, an alginate impression was taken off of which a stone model was created. A thermoplastic splint was then crafted, and it was secured into place using circummandibular wires. Based on the patient's age and mandibular fracture pattern, I most certainly agree with the author's management strategy. This case was ideally suited for the use of a thermoplastic splint held into place using circummandibular wires, rather than using traditional maxillomandibular fixation, which would have required piriform aperture drop wires and circummandibular wires. The authors describe the benefits of this technique compared to using traditional maxillomandibular fixation. Most notably, it allows for the maintenance of mouth mobility throughout the bony healing process. This dramatically changes the postoperative morbidity. I absolutely agree with the authors that intraoral scanning and 3D printing offers a very promising future for this technique. Thank you for joining me for this discussion. Keep on the lookout for more interesting case reports every month on prsglobalopen.com. We look forward to seeing you next time on PRS Global Open, Face the Case.